My name is Dr. Reshawna Chapple, and I would like to welcome everyone to our panel discussion today. This is the third annual panel in honor of the Reverend Dr. Martin Luther King Jr. Day, and it's sponsored by the University of Michigan Medicine Center for Disability, Health, and Wellness. I would like to first start by telling you a little bit about our panel and then having the participants introduce themselves. So every year, this is the third year, the Center for Disability, Health, and Wellness puts on a panel to help us understand different things that are relevant to the Dr. King legacy. And we hope to have something structured around intersectionality and disability every year. So this year, we have a panel of individuals who identify as both Black living with a disability. And we want to talk a little bit about the impact of COVID-19, some of the changes that have happened to those in the Black disabled community, particularly centered around the access to services and work for people with disabilities. We know that people, everyone had a lot of things happen and shift and change for them in terms of the COVID-19 pandemic. But we also know that marginalized populations have struggled greatly with access and with experiencing significant changes. So I'd like to start off by introducing the panel, and then we will go around with a few different questions and just try to have a little bit of a discussion. Thank you. So again, my name is Dr. Reshawna Chapple. I am an associate professor at the University of Central Florida. I also work with individuals at the Center for Disability, Health, and Wellness at the University of Michigan. And I'd like to thank Drs. McKee and Dr. Mead for allowing me to host this panel today. And I definitely would like to thank my panelists. So I am going to go around basically how I see individuals on the screen and call on each of you. And I would like for you to just share, introduce yourself, share your name, something about yourself, and if you'd like your pronouns and possibly your intersections. The first person on my screen is Teddy.
Hello, thank you so much. Good morning, good afternoon. First of all, my name is Teddy Dorsett III. I am from the Detroit area. That's where I was born and raised. I own several businesses, and I am also a filmmaker as well. I've also worked at Gallaudet University as a creative producer. My pronouns are he, him. I am Black. I am deaf. I am fourth generation deaf in my family as well, which is amazing. I'm so excited to be here.
Thank you so much, Teddy. The next person on the screen is Kiara.
Hello, everyone. Good morning, good afternoon. My name is Reshawna Chapple. I actually grew up in Arizona, but I traveled quite a bit and lived other places. I'm working at the Fremont School for the Deaf in California right now. I've been there for 5 years as a school counselor. My pronouns are she, her, hers. I also identify as a Black deaf woman. Thank you. I'm so happy to be here.
Thank you. The next person on my screen is Tamika.
Hello, everyone. My name is Mika Sitches Bruce. I'm a Detroit native and, disability justice activist here in Metro Detroit. I am a filmmaker as well, and I'm the co-director of a program called LEAD, which focuses on BIPOC, disabled individual and parents, and Michigan Disability Rights Coalition. And my pronouns is she, her, and hers. And I identify as a Black woman with a physical disability.
Thank you so much. And last but not least, Jamie.
Hello, everyone. Jamie speaking. First of all, my pronouns are she, her, hers. I identify as a Black woman with a physical disability. I currently work at Disability Network of Wayne County, Detroit, as the Advocacy and Community Education Coordinator. And most recently, I was crowned Miss Wheelchair, Michigan. So hence the crown, everybody. And I'm happy to be here today.
Thank you so much, and congratulations. So I'd like to go around and start asking some questions that we've kind of set up that I think that'll be helpful for us to kind of get to know you and a little bit about the Black disabled community. And other panelists, feel free to add or comment if you have anything to say. So the first question, and I am going to go backwards and start with Jamie. I want you to talk a little bit about your life prior to COVID-19. I know it's kind of hard to remember way back when. And talk a little bit about how things have changed for you, and particularly those in the Black disabled community. You can talk about good or bad.
Thank you so much. This is Jamie speaking. So my life prior to COVID-19, it was different, but not a huge difference. So one of the major differences was I was a lot more independent. I did a lot more on my own in terms of going around. Like I drove myself to work. I drove myself to go to the grocery store, do things that were necessary to take care of myself and my son. I'm a mother of a 23-year-old person who also has a disability. And I drove myself to the doctor. I was able to contact individuals that I needed to talk to get services and supports within my daily life that I needed to talk to. So that was pretty much it before.
Okay, so before COVID, you had much more independence.
Yes, much more independence and much more access to services and support.
Okay, thank you so much. Tamika, I'd like to ask you the same question.
Well, the biggest difference between 2019 and prior to COVID and now is that I went to work. I was working a different position at the time, but I was working for a hospital system, community health. So I used to always go into the office and every single day, and take my kids to school. There's a whole ritual, that I did, but because of with COVID, and then originally with COVID, and that's when I started working at home, which was good in the sense that I didn't have to go through the traffic, and I could remain safe and everything. So that was good. But and then I changed, positions to where I'm currently working at now, which is a remote position. But I did do, miss like going to the office and mingling with people and coworkers and stuff. So, there's benefits to working, remotely, and then also, have, being like in the office. So, and then there was, during COVID, with my children had to, be, going to school at home and things, and that was a big challenge. So I was really kind of like relieved that they were able to go back in and, and be that safe practices and such. So, so those were like the biggest challenges and difference.
Thank you so much. I see some questions also. I wanted to just kind of mention that there's some questions coming in, and I'm going to allow each question to be answered, and then I'll go back and ask the questions if there were questions about the particular question, if that makes sense. So the next person is Kiara. So how was your life before COVID, and how has it changed?
Okay. Currently, I'm working at the deaf school in Fremont, and I'm working with a school counselor. And my life prior to COVID and after COVID, it has been different. The big difference is accessibility. I rely on sign language, and prior to COVID, you'd be out socializing, signing, and having that communication all in ASL. And then, when I'm working at the school, I'm one-on-one, I'm a school counselor with my students. And then, communicating back and forth with my coworkers, and accessibility with all of that was great. But then with COVID, it felt too distant, the distant learning. And that was true for most of us, with accessibility. Some people don't have accessibility to technology. So then how do they get educated? So most people have language deprivation, and so that's been a huge challenge in trying to connect with everybody. But the nice part of it too is that we get to learn how to use Zoom. And prior to, with school, like in IEPs with individualized educational plans, the student where I work, okay, there are many students who come from different countries, and live maybe 2 hours away or 5 hours away. A lot of them live, are from distant areas, but live in the dorm. And then, the parents aren't able to make it to an IEP meeting because of the travel time being so far. And so, we use Zoom, and then families have accessibility for that. And there's pros and cons for that. But I mean, it's really, technology has been a huge challenge for us as well. And now when school is closed for the summer, some of those students need help. They need, mental health therapists there and all of that. And so there's been a huge impact on them. And with Zoom, we're able to get on virtually, and we're doing more and more of that today compared to how it was before. And so technology, the accessibility for communication has been huge for us. But, we keep going along, we keep moving along, and then now we're back in person, and everybody's very relieved and happy to be back together because the accessibility is there, and people aren't so far away. And so we're behind, but we're trying to catch up. And I think that's really been the big difference in terms of prior to COVID and post-COVID. Thank you.
Thank you. Teddy, last but not least.
Okay. Well, for me, prior to COVID, well, let me, a little background story. I have some ability to lip read, and I can speak. And before my current job here at Gallaudet, I worked with hearing coworkers in film. And, the challenge was finding a job because access to communication, need an ASL interpreter. And during that that period of time, the technology wasn't that great. So the challenge for me was finding a job, going to a doctor appointment, making sure that there's an interpreter there. And if there wasn't an interpreter, then they would bring on the virtual remote interpreter on the screen. And sometimes it was great, sometimes not so. And, you know, it certainly wasn't the best representation of our cultural needs, our comprehension, our communication needs. It wasn't that great. And that was prior to COVID for me. So that's been a big challenge, especially with that. And then also mental health, just a huge importance for me as a deaf person. I've gone through many life traumas, you know, with discrimination and racism and all of that. And so I've gone through a lot. I've got a lot of trauma, and then trying to seek out help has been a big challenge without an ASL interpreter. Now, after COVID, well, during COVID, I should say, things started to change, and there was an impact. And so there was some accessibility for interpreters because of technology. Technology was upgrading, it was getting better. And that did help me a little bit in my journey in terms of my job now at Gallaudet. The big issue is really about access to interpreters and technology. That's been the big difference. And now that I work at Gallaudet, it's so cool because I can work with others who, you know, who sign. It's a signing community. I've got access to my language, my resources, everything. I benefit there, working there. And I see that a lot of others don't have that same experience for accessibility. And so that's really important in terms of what was prior to COVID and what was post-COVID.
This is Reshawna again. Thank you so much. I have some follow-up questions, particularly individuals want to know if anyone on the panel could talk a little bit about kind of what it means to be Black and disabled. How have some of those differences changed where appropriate? Like what would be different maybe from a white disabled person, if there's any differences there? Or anything that someone without a disability might need to understand?
This is Jamie speaking. I want to say, I don't know if there would be a huge difference between Black and white, but I can tell you that, again, the access to support is different for everyone. But if you live in maybe a lower income, urbanized community where you rely on public transportation or certain things to get access to services, to get around or things like that, those were challenges because public transportation, it was dangerous to get on public transportation really because everybody didn't adhere to the mask mandate. Bus drivers, particularly in Detroit where I live, bus drivers were sick. We had a bus driver that died. People were afraid to come to work. So you had a huge decrease in the amount of bus drivers. As a practitioner, I can say working with individuals who needed to get access to maybe a housing coordinator, they weren't able to talk to anybody because people weren't coming into work, people weren't answering. I can't say if that was necessarily a African American or Black problem, but it definitely posed a problem.
Thank you. Anyone have anything to add to that?
Yeah, I do. This is Tamika. So I would say that it definitely had COVID exposed the anything, the health disparities, you know, that exist, you know, as far as with, you know, people, you know, who got COVID and, you know, and then I know disproportionately a lot of African Americans, you know, have died as a result. And then, you know, those who were like people who like in service industries and things like that, where they had to work with the public, they might work at Walmart or, different places. And, you do have some people, with disabilities who are, greeters and different things like that. So, I would think that first comes to mind, and not anything, that it really exposed, the health disparities and how African Americans are treated, in this country, and the health conditions, associated, with that.
Thank you so much, Tamika. I'd like to go to the questions. We have lots of questions coming in the chat. I have one particularly for Jamie, just a follow-up. Basically, you talked a lot about losing some independence, and I know you've kind of talked about that a little bit, but individuals are wondering, was it personal factors or some sort of functional or environmental? I know you talked a little bit about the bus drivers and fear, but was it something specific that you know of, or just kind of everything shifted?
This is Jamie speaking. So I want to say it was a little bit both. Like Tamika, I was going to the office every day. That helped me with being able to socialize, being able to get human contact. And when the pandemic happened, when that stopped, everything went remote. I actually was a research assistant with U of M on a grant. And I would go out and talk to people every day. So I wasn't able to do that anymore. Everything shifted to online, which led to some feelings of isolation. I got a little bit depressed. I didn't want to go out as much. Plus the fear of going out in my wheelchair. I use primarily one hand. So the idea of having to touch stuff, the idea of just not having that extra layer of protection really caused problems for me.
Okay, thank you. Thank you so much. And for the deaf participants, some of the attendees would like to know how you dealt with people wearing masks. I know that was a huge issue for a lot of deaf individuals who use sign language. How did you deal with that? Teddy or Kiera?
Well, this is Kiera speaking, or signing, I should say. The mask mandate was a huge challenge because I rely on lip reading as well with sign language. So if it's a hearing person, there would be texting. Some people wouldn't pull their mask down to their chin, or even use a phone to communicate with me. No, some people just absolutely refuse to do that. And we were not able to, if I could accommodate them by using a phone to communicate, I mean, that whole mask thing, I mean, there was a lot of fear with that, but it was tough. And now, we've gone from mask to basically nothing. And then we had the see-through mask. And so that was helpful, but not everybody used that particular mask. So the challenge was really about some people not being willing to communicate, like just maybe writing back and forth, or saying, do you mind repeating, and be like, no, like, nope, don't want to communicate with you, and just done and walk away, or just ignore me. And so that was a big challenge. I don't know, Teddy, what do you think? You got anything to add? This is Teddy speaking. Definitely right there with you, Kira. It was a huge challenge. Like I said, I lip read some, and that was hard. And so, if you've got a person who doesn't really rely completely on ASL, and they rely on facial expressions, it was so much more difficult with the mask on. And so, either way. But for me, with COVID, that became a huge challenge. And that's pretty much the same thing as what you experienced, Kira.
Okay, thank you. This is Dr. Chapel speaking. I'm going to move on to the next question. Can any of you discuss some of the specific challenges for the Black disabled community? And I'm thinking, I know we talked a lot about access, but I'm thinking a little bit more about maybe ableism or racialized ableism, just some general questions, because we want to think a little bit about helping our community at large understand the best ways in which to work with the Black disabled community. Teddy, I see you kind of having your hand up or thinking a little bit.
Yeah, just real brief. Well, the thought for me is there's two things: visible and invisible disabilities.
Okay.
And I mean, you look at me, you see me, I look quote unquote normal. I don't have any physical disability. And that's the first thing that people would see. If I don't do any sign language, you know, and so that ends up being a huge challenge for me because I'm not really willing to disclose my disability for many different reasons. One is that I've already recognized, I mean, obviously I'm Black first. And, you know, the first thing they're going to notice is the color of my skin before my disability. So how do I engage with people? How do I show my disability without fear of discrimination? And so that's a big issue. You know, the disabilities that are visible and those that you cannot see. And so that's been a struggle. You know, I need more education about that.
Thank you. Anyone else?
Yes, this is Jamie speaking. I want to say first that I agree with Teddy. The difference between visible and invisible disabilities during the time of COVID was always a big issue, but during COVID it was a bigger issue. I didn't specifically have any incidents like that, but I can speak to one thing. So again, I talked about public transportation. In Detroit specifically, what they did was they had everyone that did not have a disability to enter the bus from the back. Because the buses were free during that time. You could get on and off as you choose. But if you had a disability, you would signal the bus driver, they would open the door and let you in through the front. And I do have a friend that has an invisible disability. They needed to enter the front of the bus. They needed the bus to kneel. They don't kneel in the back. They only kneel in the front. Well, the bus driver wouldn't let them on because they didn't see a walker. They didn't see a cane. They didn't see a wheelchair. They didn't see any indication that this person had a disability. So to me, that's an issue because if I tell you that I have a disability, regardless to what you might, disability should not have to look a certain way to people. That's an aspect of ableism, right? Because you expect disability to look a certain way. In terms of racialized ableism and access issues in communities, for instance, where I live in Brightmoor, it's a smaller community, there were not a lot of clinics. There were not a lot of testing clinics. It was difficult for folks to get access to masks or gloves or things like that, especially if you have someone coming in to the home to take care of you. A lot of the disability justice organizations had to figure out ways, like they have people knitting masks, they would apply for grants. People couldn't get their groceries. So there was a lot of us taking care of ourselves. I don't know if that was an issue in the white community, unfortunately. That's not how I identified. I did not have a lot of contact with individuals in the white community to say whether that was an issue. But in communities of color where you have food deserts, where you have far spread out homes. So you don't have bus stops, you don't have trash pickup like in other neighborhoods that have more homes. You're gonna experience this trash piling up. You're gonna experience so many other things that you may not experience in a different community, whether it be BIPOC or not.
Thank you, Jamie. Yes, I see you nodding your head, Tamika, Teddy, actually. I see everyone nodding their head. I think some of the things just tend to be different when we racialize it, and then also depending on the community in which you live, things might be a little bit different. So I want to shift just a little bit, and I want each of you to kind of tell me a little bit about some of the ways that the Black disabled community is resilient. Because I know as a Black woman myself, it appears that sometimes we can just figure things out. And through COVID or through whatever those struggles are, we will figure out how to get things done. And I know that it's especially true for your community. So I'd like for you to talk a little bit about that if you can.
Yeah, I guess Ms. Tamika speaking. Yeah, definitely. There's many examples of resilience. Just thinking of people like Stevie Wonder. Thinking of I know when it becomes particularly of the person with that did with spina bifida that learned with people with hydrocephalus. That was to drain the fluid. That was created by a Black doctor, a Black female doctor. So there's many, stories in history, where, African Americans and, African Americans with disabilities were, and are able to, overcome and deal with the discrimination and still be, the people that they, were born to be. So just taking a minute to, express and uplift people like that.
Thank you. Was thinking too specifically about kind of thinking about now and thinking about some of the average struggles that many individuals are having, particularly with access. That keeps coming up over and over again. How are we accessing mental health? How are we accessing healthcare, particularly with problems with transportation? And then some of the other things that happen. I mean, we know statistically, Black individuals don't receive the same types of healthcare that white individuals receive. And if you add a disability on that, both invisible and visible individuals are treated differently. And so, I wanted to think a little bit more about that. That's just kind of me kind of thinking off of the cuff there.
Oh, I'm sorry.
All right, Jamie, go ahead.
No. So this is Jamie speaking. I will say my favorite thing to say is that Black people have a keep it moving culture. We take whatever it is and we just keep it going. If you can't get to the grocery store, disability organizations around Southeastern Michigan developed a delivery service where they got a couple people that could drive and were willing to go to develop grocery service to get people their groceries. You would have families that if they were able to all come together in one household so that they can pool resources, they would do that to be able to help one another. Other ways that Black individuals with disabilities are resilient is as Tamika said, we create our own ways. If we can't get it from somebody, we create it ourselves.
Thank you so much. I'm going to go back to the chat for questions. This is very interesting, kind of looking at all the questions and watching everything. And I think I found out that I'm the only one that can see them. So maybe some of the panelists. So I'm going to go back to the questions again. This question is for Teddy, actually. It says Teddy hit on a big point that was discussed in the deaf community, that his Black identity comes first. This is quite common among Black deaf individuals. For non-deaf panelists, oh, this is for everybody, I'm sorry, the non-deaf panelists. How do you conceptualize the most important identity for you? So I guess the question is for Tamika and Jamie, whether or not you see yourself as Black or having a disability first in terms of your identity.
Yeah, well, for me, I would say that, I have a spinal cord injury. And so I became injured when I was a little baby. And so this is all that I know, being physically disabled. So, and then being Black, and all my life, I pretty much, when people see me, they see all three identities. And so, I experienced racism. I grew up in a predominantly white school, from kindergarten all the way up to, a college, where I was the only Black person in the classroom, especially in my elementary schooling years. So, I experienced racism. I, had challenges being, brown skin, so colorism, and deal with the European standard of beauty, and then of course being disabled. So it's really because of using a wheelchair. I never was able to say, oh, I'm just a Black person first. For me, it was all three. And it's really hard sometimes to determine, when I interact with people, what are they basing that, discrimination or whatever they say. Why are they saying it? It's because I'm Black, or because I'm a woman, or because I have a disability, or a little bit of both. So it's hard for me to decide.
Yeah.
This is Jamie speaking. So I would agree with you, Tamika, to a degree, that when I come into a room, you see all three. However, because I entered the room in a wheelchair, you see that wheelchair first, almost. You see the Blackness and you see the wheelchair almost simultaneously. And regardless of how articulate I am, how intelligent I am, how much I blend into my surroundings, I'm always the person with a disability. I can be in a room full of Black women, I'm still the one with the disability. Right? I can be in a room full of disabled people, I'm gonna be the Black woman with the disability. So it really is depending on what environments you go into. There's not gonna be one specific answer. I can remember, if I have just a little bit of leeway, participating in an anti-racism class program. And we were all we did this exercise where the facilitator would call out something.
Yep.
And if you experienced it, you move forward. If you didn't experience it, or if you didn't have that privilege, you didn't move forward. Well, when I arrived there, I believe I was the only person in a wheelchair there. And I sat at the table with a bunch of women educators. They were white women educators, and we all were sitting around talking. And it wasn't until this exercise where they were moving forward and I was left behind. Pardon me, that I think it really even struck them, right?
Yeah.
I can recall one of the women actually looking back at me and crying because of the impact of, seeing me so far behind them. having conversation with me, having lunch with me, interacting with me the way that they did, they would have no idea about all those other experiences. And it was a wake-up call for me as well.
Thank you, Jamie, for sharing something so personal. As an educator, I've done that exercise. It's called the privilege walk, which is pretty ableist there because it is called the privilege walk. It just really says, there's questions about like if you had books in your home, if you never worried about where you were going to get your next meal, different things like that. And it tries to show privilege very visually. So it sounds like it really kind of worked out there. And I'd like to add something that I found interesting in listening to you talk, Jamie. In my research, my dissertation was on Black deaf women. The same thing that you and Tamika kind of said resonated when I did research, in that there was identity on people with intersecting identities, particularly race, gender, and disability, was fluid. It would move according to whatever the situation is. And so I kind of hear that the two of you, Tamika and Jamie, are saying that with a physical disability, being Black with a physical disability, that the Blackness and the physical disability or using a chair cannot be separated because they're seen at the same time for the most part. So thank you. I have a question. Kiara, I see you raising your hand.
Okay, yes, I do have something that I want to add with this as well. As a deaf person and talking about accessibility, as Teddy said, I think that people do see me first as Black, and then when I sign, as soon as I start signing, then they're like, oh, you have this additional identity as a deaf person who's an ASL user. But where I was raised and where I went to school as the only deaf person, I was in a mainstream school, in a public school with all other hearing children, we'd have interpreters all day with me. And I realized that we had people, they looked at me and they went, oh, well, do you have special needs? I said, no, I just need an interpreter for communication. That's it. I'm deaf. I just can't hear. That's a grand total of it. But I had to fight for my education. And I remember looking back, there were some teachers who would try and move me into like a specialized program, with additional support. Like, no, I don't need that. I want to be in the mainstream classroom with everyone else. I'd have to fight for it every time to say, no, I'm able to do that. Just provide me a sign language interpreter and I'm good to go. But there were so many challenges in regards to that, in regards to discrimination. And sometimes they'll say, oh, no, we can't do a sign language interpreter. They would take the sign language interpreter away. It's like, no. I need to use sign language to communicate. They said, no, you can't have the interpreter. We're going to be here to help you and do other things. I said, no. The interpreter is not helping me. They're not cheating. Nothing else is happening here. They are providing language accessibility. They're facilitating communication, and that's it. So yes, I am deaf and I am Black. And in my school growing up, that's how it was seen as well. They would say, oh, you can't do it. Oh, I don't think you're going to be able to graduate school. You're definitely destined to fail. I was able to do it. I went all the way through. I graduated. I went on to college. And there were a lot of challenges in college as well. So I was able to prove that a Black deaf person could do things, even though I've been told so many times, no, you won't be able to do that. But I just kept having to meet higher and higher challenges as I went along. There were a lot of challenges growing up as I look back now.
Thank you so much. Teddy, do you have your hand up?
Yes, I do.
Go ahead.
Thank you. This is Teddy talking. And definitely, it's right. There is racism. It's still going on. It exists. And, it doesn't matter how much you code switch and try to do all that between my, like your identity, me as a person, my disability, my access needs and all of that. Every day I'm constantly code switching. Okay, am I deaf first or am I Black first? Which is it? So I'm constantly going code switching, and it's mentally exhausting. And the impact for us Black people in our community, we're already experiencing racism. And then you got to add disabilities on top of that. This is just ridiculous. And, you know, and for me, I'm a Black deaf person, and I always find it frustrating to get equal access. I grew up in all Black schools, and, you know, Detroit, you know, my parents were always, you know, preaching to me, you're Black first, because people will, you know, you'll look somebody out like somebody else, they'll mistake you for somebody else. Because if I look like another Black person, you know, on the street, then they'll think that I am the same way as that person on the street. And the experience, there's a negative, you know, connotation with racism and that discrimination. And it seems to be when somebody hears that term, there's an assumption that, you know, you can't, you're nothing, you're not strong, you're weak. And every time, you know, you hear that, they'll hear that word like Black or deaf. And then there's an assumption that I'm weak and that I can't do anything and that I'm not able. And, you know, that stuff needs to go away. And for me, I'm a Black deaf person. And so I'm always fighting to prove something, just like Kira said. I always feel like, you know, I'm even today, I'm still having to worry about, you know, will I be dead tomorrow if somebody assumes that I look like another person, or, you know, something negative with that. And I don't want that. And so that's a big issue. It depends on where you live. It depends on where you grew up. And, you know, kids with education, you know, they don't have proper access or the best representation of teachers, you know, that can really identify with them. And so, you know, how do they grow up feeling confident? And if we don't have that, we're already losing half the battle. And there's just, I mean, the list goes on. I could go on and on and on and on, but it's still going on today. And we need to really look at that.
Powerful point everyone is making. And it appears, just to kind of sum up what everyone is saying, is that you're going to get the benefit, you're not going to get the benefit of the doubt, particularly as a Black person with a disability. You know, for the most part, people are going to think that either you can't do it or you shouldn't be there. You're not worthy, those sorts of things. And those are the things that are continuing today, unfortunately, that we're hoping to get rid of and fight, and really, really focus on what the legacy of Dr. King is, I'd rather say it that way, to continue working on that. I know we have, yes, yes.
This is Jamie speaking. I noticed there was a question in the chat regarding lack of access and what can be done to enhance access. So as a person who works as a person with a disability that works with other individuals with disabilities to help them get their needs met, one thing that I see with the lack of individuals working in social support areas, there could be an empowerment to different disability organizations, like for instance, a disability network or something like that, to act as a step, like what am I trying to say? Like a place where a person with a disability could go to get their needs met, because you have, for instance, you might have a housing authority or a DHS or something like that, where workers are over inundated with people for whatever reason, whether it be in the Black community or white community. They have a lot of cases, like 500 cases, 300 to 500 cases for one person is just ridiculous. And then when you add in a person who has a disability that may have a specific access need that person may not be equipped to understand, it could cause them to fall through the cracks. I think one thing that could be done to enhance the services actually is two things. One, there could be some kind of movement where people who understand disability, who understand these service systems, and can identify with the people in their area could be empowered to work in these areas. If you know how to navigate the system for yourself, you should know how to navigate it for someone else. It doesn't, it doesn't take a rocket scientist. If I can fill out an application for health insurance or for housing or for something for myself, then I should be able to work with a friend or someone who I have something in common with to do that. So why not work to hire people to help lessen these caseloads?
Okay.
The other thing is empowering these service agencies who are already servicing individuals with disabilities that have these specific needs to be able to work with them and then interact with that division of social support service on their behalf. That would definitely cut down on the number of direct applications, direct requests for access, or whatever the case may be.
Thank you. I'm going to cut you off. I just wanted to make sure that that you had gotten your point. Does anyone have anything to add? I can go back and kind of read what that question was. Basically, it's the question that says, we all know that the impact of COVID continues, both with how it impacts health, as well as its impact on employment and staffing, reducing hours and access to many things, from childcare to transportation to store hours. What do you think has been the particular ongoing impacts for the Black disability community, and what can be done to enhance access? That was the question. Anyone want to add anything to that? Teddy? Go ahead.
Yes, I do want to add something. This is Teddy speaking. In general, we should really start thinking ahead than later on. Instead of waiting, let's say, until there's harm, and and then that harm happens, and then we do something about it, or we wait for somebody with no experience to get harmed and then address that and share their experience to influence change. No, we need to do it the other way around. We should be taking the leadership, the initiative to include everybody who would benefit in terms of equality. And that's really important because, we've already recognized there's the system. If the system's set up, it's against us. And we've got to continue to share our stories and work together and partner together and work with many different social justice organizations, and leaders in the Black and Brown community who have direct connections to those communities. And, we've got to think ahead, not later. I'm just done with that. And brothers and sisters, their attitude, hey, you know what, I'll tell you later, we'll take care of it. No, let's go, let's partner, let's sit at the table and let's talk about this. Let's listen to each other. Let's engage. Let's have those comprehension and I get it moments. And, at the end of the day, we're all human. And so let's, think about others than we think, instead of thinking about ourselves. And as Dr. King said, the goal was, he wants all of us to have equality and have that and work together. And that was the big mission.
So we only have like a minute left. I know these conversations go so quickly. I want to just kind of read this last point that is coming on, and I really want to applaud Teddy and the rest of the panelists. That last point just kind of, it it actually got my last question, because I was going to ask what are some ways that we could elevate the community thinking about Dr. King's dream. But I'm going to kind of hold on for that and just kind of say in closing that it sounds like working as a solution for disparities and ableism and racism, we really have to work on focusing on the system and thinking about what is in the best needs of everyone, not necessarily just what I need or what used to work, but definitely breaking down what is working, what is not working, and being able to start operationalizing how to get all of these things fixed and together. So I want to thank my panel. I appreciate all of you so much for showing up and sharing your wealth and your information and your time. And I apologize if I did not get to your question. Thank you so much.